Assalamu alaikum wa rahmatullahi wa barakatuh. This is Ruqiya Almamari. I'm lecturing at Oman College of Health Sciences. In this evening, I'd like to, and on behalf of Oman Pharmaceutical Society, to welcome and to thank all attendees for joining us in today's webinar. And I'd like also to join our colleagues in thanking Oman Pharmaceutical Society for their effort and for involving us in the updates of the latest and the most important issue in the field. Today's lecture is about literature search. Fatima Alraisi, inshallah, will enrich your evening with the best scientific methods in how to do a proper literature search for your studies, projects, any mission that require the most relevant, updated, and evidence-based data. Fatima graduated from King Saud University in CASP in 2000 and started her careers as a pharmacist in Royal Hospital from 2000 till 2015. She did her MSc at Strathclyde University, Glasgow, and graduated in 2006. And since then, she worked as renal clinical pharmacist at Royal Hospital till 2015. And then she moved to academia to Oman College of Health Sciences. Fatima then in 2016 started her journey as a PhD candidate at Robert Gordon University, Aberdeen. And mashallah, she published 7 scientific papers in peer-reviewed journals. Before welcoming Fatima this evening, I'd like to have a wee reminder that if you have any question, please you can leave it at the end of Fatima's presentation, and you can type it using Q&A button in the toolbar. So please join me in welcoming Fatima. The microphone is yours, Fatima. You may start now.
Good evening, everyone, and I'm really delighted to be part of this webinar. Thank you very much, Ruqiya, for introducing me, and thank you for the members of the Oman Pharmaceutical Society who worked hard behind the scene for the success of this event. So now I'll just share my slides. Okay, and as Ruqiya said, this presentation will be about literature search and how to do it in the most efficient way. Okay. So, okay. The layout of this presentation would be, we would know what literature search is, the reasons why we do literature search, types of literature available out there, what challenges do we face when we attempt for literature search, and what skills do we need to do it in the most efficient way, what search tools are available, and how we can critique these search outcomes in the most efficient way. So what is literature search? Literature search is a well thought out and organized search for all of the literature published on a topic that you are interested in. So you have an idea, you have a research question, and now you want to do a literature search about it so that you don't invent the wheel, and you need to find out what other people have done on that similar topic. And doing literature search well will save you lots of time on the long run. So it has to be organized, it has to be structured, and of course it has to be evidence-based. The reasons for searching the literature, why we need to do literature search. Definitely there is something in your mind that you need to answer. There is a specific question, there is a specific interest or topic you want to know about. So this is what makes you start searching the literature. We don't want to invent the wheel. We want to know what other people did in the area of my interest, so that I am not all alone. I know what happened already, and then I can take it from there. And of course, you need to learn appropriate method to do that. So you need to broaden your knowledge on a specific topic. You need to show your skills at finding the most relevant information that is related to your topic. And of course, you need to determine the current best practice that's available. And you know that nowadays the talk of the town is COVID-19, and everyone is interested to know what's going on in the management of COVID-19, and we as pharmacists, we care about the best practice to treat COVID-19, what's available out there, and everybody, I think, at some point did some type of search on this topic. So there are lots of different types of literature. We have scientific and academic scholarly. We have text and reference books. There are journals, medical journals that I think most of the pharmacists would be interested in and can relate to. There are research reports, there are papers, theses, and of course there are non-scientific literature as well. Some people would be interested in topics that are published in news, in comics, in magazines. So all these types are of literature, and everyone would search in an area that they're interested in. Definitely there is challenges everywhere in every field. So what are the challenges that we face when we search for literature? The first challenge definitely is growing quantity of publication, which may cause problem in searching and browsing. So there is lots and lots out there, and how to be very precise. So which means that the percent of your result that are relevant to the topic that you are really looking for, versus recall, which is the percent of the relevant results that are really correctly classified in your search terms. So it's lots of publications, but you have to know what you are looking for. The other challenge is the quality of information. There is huge amount of information out of there. You can't take everything for granted. You need to know, is this information I'm looking at reliable or not? And if it's unreliable, what are the reasons behind that? And here we can use the tools that I will show you later for criticizing the literature. Another problem is availability of information you need. Imagine if a doctor asks you what's the latest treatment for COVID-19 out there for a pediatric patient or for a patient on ventilator. If you cannot find the answer then and there, then there is no use of that information because you need it at that time. So is it available for you? Can you access it when you need it? And one of the other challenges would be constraints in accessing due to various reasons. Is it technical? Do we have the facility to access the internet if we need a soft copy? Economical, is the organization paying us to access certain databases or not? And definitely political. So these are constraints that you cannot access the literature that you're looking for. Definitely you need skills in literature search. You can't just go and do a Google search and you think that you found everything you need. So you need to first be able to identify various kinds of publications. What are you targeting? What you want to look for? And this really depends on your question or your aim, or what is it that you are looking for. Remember, always, if you want to write your aim or your research question, it has to be in a PICO form, where you need to mention your population or the problem that you are interested in, and then I is for the intervention, and C for comparator, if there is any, and what outcomes are you looking for. So you write your aim in that way. Or Eclipse. Eclipse is another way for writing your aim or research question, where E is for expectation, what is your expectation, and C is the client, again it's the same as population. L is for location, I is for impact, which is again the outcome. P is for profession, are you looking into specific profession, and S for the services. So if you write the right question or your right aim, then you will know what publications are you targeting. So say if you are looking into a pharmaceutical drug or something, then you will not go into an economy a database to search for it. You will know that you need to search in a database that is relevant to pharmacy papers. So you need to also be able to know and use various search tools. There are lots of databases, different databases, and each database has its own tools. For example, say if you go into PubMed, you need to go first of all and read about the search methods in PubMed. What tools do they have? What abbreviations do they use? So that it will make your life easy when you search in PubMed. You need to be able to conduct efficient and effective search and implement relevant search strategies. And I'll show you that in a bit. And you need to be able to evaluate the quality of information. We cannot just take anything and say, yeah, that's the perfect paper. You need to see the bits and pieces in that paper to make your judgment about the quality of the information. These are some search tools that I managed to show you. These are from most of the databases would use these tools, but you need to understand each and every one of them. Some databases use a catalog method where they have a catalog and you can know how to search. Some use web search engines, and the easiest example would be Google Scholar. Boolean operators, and I'll show you later how we do that. And there are some symbols and wildcard truncations you can use to broaden your search. Of course, your search term that should be very relevant, your keywords to your topic. Subject headings, we will again talk about it. Nesting, and you can limit your search with either dates, the population you're looking at, and the type of publications you are interested in. So you can limit your search with that. So search terms. Search terms are sometimes also referred as keywords. They can be a subject, a topic, any distinct word used as a point of access to your data, to your literature. Using appropriate search term is very important in the process of searching. So that's why even deciding about your keywords, once you have your aim or your research question ready, you need to sit and decide and use. Sometimes you would write some words and you will not find anything. You will need to change it a bit and do another strategy. So this is one of the tricks that you need to work on and decide what keywords you need to search for your data. Using appropriate search terms is essential in the process of searching, as I said. So therefore, conducting a search, it's necessary to brainstorm for possible search terms and represent your search queries. Okay. So subject heading, as we said, what is subject heading? Subject headings are a list of controlled language commonly used to classify library material housed in a collection. So they have a collection, they have certain words that are already fit there related to the, so you will represent that word as a key topic of your publication. An example is the mesh terms, which is very commonly used in most of the databases, which is medical subject heading. It's developed by the National Library of Medicine. It's a controlled vocabulary, which is very distinctive feature of Medline and so many other databases. It imposes uniformity and consistency to the indexing of biomedical literature. So mesh term could be like, if I say chronic kidney disease, if that's a mesh term, anything related to that topic would automatically be included in your search, whether it's the renal, whether it's nephrology, whether it's dialysis, transplant, everything will be in that mesh term, under that mesh term. And of course, the final column would confirm what I'm saying. So mesh terms are arranged in a hierarchical categorization manner called mesh tree structures and are updated regularly in all the databases. Okay. And then we have the Boolean logic. What do we mean by Boolean logic? Boolean is a system of logic developed by an English mathematician, George, that allow the user to combine words or phrases representing significant concept when searching an online or a database by keywords. The most common operators are and, or, and not. But again, each database has its own ways of using these words. In some databases, like and would be represented by a plus symbol. In another database, it's by default. If you do have two words, it will automatically act as if there is an and between them. So it depends on the database you are searching. And to make it more clear about the Boolean logics, I'll show you this here. So here you can see in the first figure, if we are searching strawberry or vanilla or chocolate, so I need either one of them. If you see the highlight, all three would be captured in your search because you want either one of them. But if you say, I want strawberry and vanilla and chocolate, so it will only give you the combination of the three. So only the middle bit is highlighted. And then how we use not, say if you say, I want strawberry or vanilla, but not at all chocolate. So anything that has a chocolate, it will never appear in your search. So or is to broaden your search by including different synonyms and related terms in that query, and will combine two concepts and it will narrow your search. Not will exclude any unwanted recodes from your search result. So before going to truncations, I would like to show you what I have just told you. So this is Medline database. It's from my university website. So I'll just show you how we do that search. Say if you are searching a Medline, can you see up there, Mesh 2020? What does that mean? It has been updated in 2020 and you can find your mesh terms here. Because of the time, I cannot go into each details. I will just show you a simple example. Say we search COVID-19, okay? And these are, if you go into the next bit, these are, what do you want? Do you want your COVID-19 to be in your alt text, abstract, in the summary or whatever? You can select it from here, but we will leave it open and we will search. You can see now what will happen. Select the source. What happened? I think there is a problem in the database. So let's go back and I'll just tell you. So if you typed COVID-19 here and you searched, down you will find the number of articles that are capturing COVID-19. I wanted to show you how to use the and the or. You can see these are here. You can select either of them in the database. So each database has its own way of searching. You can easily do that and you can practice it. Okay. Going into truncation and wildcards. Again, each database has its own truncations and wildcards. Truncation is a searching technique used in a database in which a word ending is replaced by a symbol. Symbols can be any symbol depending on the database. So you need to know the database. And I will show you an example just to understand. So rather than writing a search, say you want to search pharmacy, any word that relates to pharmacy, like pharmacy, pharmacist, pharmacies. So rather than writing all these words, what you can do, you can write pharma and you can use one of the symbols according to the database that you're using, and the result of the search will document any word that contains pharmacy, pharmacist, pharmaceutical, or pharmacies. So it will capture everything. So these are one of the techniques. Rather than writing all these words and doing many searches, you can just use a truncation wildcard to search everything by writing just the first bit of the word and then with the appropriate symbol according to the database. There are some tips. Definitely there are many more to do, but there are some tips I can give you for effective search. First of all, plan it well, especially if it's related to your research you are doing or a project you want to do. Plan your search, or identify the words that that represents the topic that would capture the maximum amount of literature that you want. Avoid using too broad or general terms. Instead, use very specific terms to get limited but relevant results. Use limits, use filter functions as necessary. Usually these are at the side of any database. You have a limit where you can select the dates. So say if you're searching something related to COVID-19, would you leave it open? Was there anything before 2019? So you will select any paper from, say, December 2019 till to date, rather than just keeping it open to capture everything, which is not relevant. Create an account. Most of the online databases allow you to sign in for an account. This will help you manage your search. You can save your search as well in the databases. Again, because of time, I would have shown you how to do that, but we can't do it, unfortunately. But maybe at some point we can do a more extensive workshop about this, and we can work on it and do it properly, hands-on practice. Maybe Oman Pharmaceutical Society can organize something for us at some point when all this COVID thing is finished. Okay. Word search. It's important that you focus where you want your word to come, because otherwise you will end up with hundreds of papers and you will need to scan and skim all over. So you need to know, do you need your word in the title as a keyword, in the keywords? Do you want it in the abstract? Do you want it in the full text, and so on? So these are also something you can select in the database, that if I'm looking for a clinical pharmacy, I want my clinical pharmacy to capture in the title. It should be in the title. Otherwise, it could be mentioned at one point in the literature, but it's not relevant to my topic. Now, coming into critiquing the literature, you found your literature, you have a list of papers that you identify that is relevant to your topic. And imagine you found, say, 20 papers that are relevant to your topic. It's important that you know, is this really relevant to your research? Is the study significant? What are the strengths? What are the weaknesses? What theories or methods are used? And is the research biased or not? There are lots and lots of tools tools out there to use. I will show you only one example. And if you remember the videos that had been posted by the Oman Pharmaceutical Society related to COVID-19 in series, and I think the host was always critiquing the literatures that are related to certain topic on COVID-19, whether be a treatment option, and always he would bring the papers at the side of the video and tell you this paper said that and that, but did you notice that this was the issue, this was the weakness, so this is critiquing the literature. But to do it appropriately, you will need some tools. Critical Appraisal Skills Program tool, which is the CASP tool. This is a set of 8 critical appraisal tools. They're designed to be used when reading research. These include tools for systematic reviews, randomized control trials, cohort studies, case control studies, economic evaluations, diagnostic studies, qualitative studies, and clinical prediction rules. So this is an example, but let us go live and see the tools. This is the page. So if you type CASP in Google, you will find it. And this is the website, and it's easy and it's free. You can access all the different tools. So here you can see the list of tools. This is for systematic reviews, and this is for qualitative papers, for randomized papers. So these are all these different. If we pick one of these, say maybe the randomized controlled trial checklist, it's very easy and to the point questions. So if you see question number 1, did the trial address a clear focused issue? And it gives you here the hints that what do they mean by this question. The population was mentioned, the intervention was given, there was a comparator, the outcome was considered. So if yes, you will tick yes. If you can't find certain answer, then you can't tell if they did or not. And if it's a no, it's a no. And there is a place for you to write your own comments. So as you answer all these questions, I think in the quality randomized, there are 11 questions. Once you answer these, by default, if most of your answers are yes, then your quality of this paper is good. But if most of the answers are can't tell and no, then the quality of the paper is poor. Okay. So these are one of the tools. There are lots of different tools that you can use. There is a Black and Down. Their tool is very extensive. I have used it in my systematic review. There are, I think, more than 20 or 30 questions. I don't even remember, but it's huge. It's very detailed, and it gives you a scoring as well. And the scoring means that if your paper is from 0 to 1, it's low quality, from 1 to 2, and there is a clear scoring system. There are tools from Guana Bridge. There are lots and lots of different tools, and depending on what you are doing, you can select one of these tools. So in summary, literature search is a useful skill to find most relevant evidence to a given topic, and following planned steps will help you obtain best evidence in timely manners. And I'll just show you how I managed to write my literature search when I did my systematic review. And we have this document which makes it so clear that even that I have done it in 2017, when I look at it, I remember exactly what I did. So I wrote my aim, which helped me select the words and the keywords that I will need. And then the databases that we wanted to use and search, and there was no time limit. And as you see, the first was in PubMed. There was core terms, the major terms that I'm interested in, and then there were sub-terms to use. And you can see mesh me and whatever below is that where I am looking for these terms. TI was in the title, AB was in the abstract, and so on. And the hits were that when I searched for pharmaceutical service, 59,253 papers were captured. But definitely, these were not all relevant to my topic. But then I started to combine them with all these words with or, and then we had this number, and then we combined them with and at the end, we ended up with 1,273 papers, which were again to go through and scan the abstract and scan the full paper to get to your most relevant papers. And here I think I am done, and back to Ruqiya.
Thank you, Fatima. Can you see me?
Yes.
Thank you very much for this rich content, Fatima. You honestly made our life easy in terms of being very precise and accurate while obtaining our data for various projects. And now we can conclude, as you said, that literature review is the first step and the gate for answering our research questions and for achieving the aims behind any project or any research in the future. Thanks again, Fatima. It was very informative. It was very helpful and to the point talk. Thank you very much. So before answering the questions, I'd like also to inform our audiences that Oman Pharmaceutical Society is continuing to publish its webinars, inshallah. So you are welcome to participate, to give an opinion, to comment in anything. Their doors are open for you. So follow them in their social media accounts. So back to you, Fatima. Can you find the questions now?
Yeah.
Okay, you may start.
Okay, so can you hear me? Yeah, okay.
Yes.
So there is a question, how to document the research strategy in the literature review and what's the structure? As I told you, the first thing is you determine your aim and objective, as I showed you in that document that I did. And if you are interested, maybe I can send it to the Pharmaceutical Society to share it with people who are interested to have that document. Once you set your objective, your aim of your study that you are doing, and you set your databases that you are searching in, all your limitations, that's the first structure. Once you decided about your search terms, you start searching in each database that you have selected. So this is the structure of it. Definitely there is more details. Maybe we can answer it privately at some point if you are interested. Okay, there is another question. Any recommended free database available here in Oman? Okay, so there is another question. Any database that's available in Oman? Yes. I think the best would be to go through the Ministry of Health website. They have lots of free database that you can access, and that would be the best platform for us as practitioners in Oman to get access to most of the literature out there. Okay. Any other question? Again, I think it's a very similar question. Can you give us some of the sites or websites that are best in developing the skills of students that are interested in research paper? I think that's difficult to answer because there is no specific website to develop the skills of the students, but I think there are lots of literature out there that helps you. So if you search for papers that helps you how to search literature or how to do a proper research paper, I think you can find lots of things out there. But the best would be sites that are related to a university or to a college. That would be the best. And definitely there are books out there about research. There are lots of useful books out there about research. They're very simply written about different research methods and how to do it. So these are lots of books. If you need a specific reference, I would really suggest some books for you, and maybe we can share that later at some point. Okay. I think you have captured mostly everything. Yeah, that's answered, and I think that's it. How to make my research question precise? I think it's very important that you know what are you looking for, and don't make it so broad. Try to be to the point, to make it precise, rather than going into lots and lots of core terms that will distract you. I think you have to be focused. For my systematic review, my first attempt, core terms were more than 10 core terms, but then
Okay.
we ended up only with 2. So you have to be very, very narrow with your topic. And I think
Fatima,
for the sake of the time, I can't answer more questions.
it's okay. Thank you very much, Fatima, for answering the questions. And you can leave the questions. We can answer them later in the chat or the Q&A button. It's the end of today's webinar. Again, I'd like to thank you. And please stay home, stay safe. Thank you. Bye.